Hi, I'm Susan Taylor with Scripps Health in San Diego, California. There's lots of information out there for moms to be on how to prepare for the arrival of their baby. But what about the dads? What should they be doing to get ready for this big change in their lives as well? Joining us to talk about this is Dr. Brian Scull. He is a pediatrician with the Scripps Coastal Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thanks for having me.
So much attention is focused on the mom to be. What about the dads, though? What should they be doing to get ready for this arrival of their newborn?
Yeah, there are lots of things that dads can do to kind of prepare for that initial newborn coming in their life. And again, this will resonate with any partner who is assisting somebody who is having a new baby. There are parenting classes that you can take. You can find a family friend that has a baby in order to get a little practice there. Going online, American Academy of Pediatrics, which also sponsors Bright Futures, has lots of informative things that fathers to be and partners to be can have in regards to getting prepared for that new addition to their life.
So, what are some of the biggest concerns that the dad to be has?
Most of the concerns I hear about are when will my baby be born? How will they be born? What will happen afterwards? And those are really tricky things to answer because you just don't know. But again, they do cause some anxiety, and there are things that you can do to really prepare for those, like we said before. But just kind of rolling with things as they go is one way of just being really prepared, being very flexible with the plans.
And what about learning the basics? How to hold the baby, how to change the diaper, burp and swaddle the baby.
Yeah. Those are great questions. And there are what they call getting ready for baby classes or parenting classes, in which sometimes they'll utilize a doll or just finding a family member or a family friend that has a baby just to get a couple of those, initial holding, burping, feeding, swaddling practice before the baby comes.
And what about safety measures like installing a car seat and then baby proofing your home?
Yes, those are things that are tricky because the baby's not there yet. So many times children will remind you what you haven't childproofed, but a lot of parents will go through that initially, setting up the baby's room, have a friend come over and take a look at it, make sure, oh yeah, you forgot about this, and just kind of double check your work there. Having a car seat ready to go, having it installed, and again, making sure someone looks at that over your shoulder just to say, yeah, that looks really good. Just kind of backs you up when it comes to that. Other safety things to do prior to the baby being born, taking a CPR class. A lot of parents kind of do that after the fact, but I always recommend doing it before the baby comes.
Interesting. And what about planning about what your role will be and the mom's role will be? So basically knowing your roles, like who's going to prepare the meals and shopping and diaper changing, laundry, cleaning the house, putting the baby to sleep, who gets up in the middle of the night?
Yeah, there's lots of changing roles. A lot of times things are really teased out after the baby's born. If feeding is going perfectly well, a lot of times the partner can assist in other things. Sometimes they're not going well, and you need to kind of tag team a little bit when it comes to those feeding schedules. But I think the most important thing is to be flexible, try to come up with a plan before it happens. And then as the plan goes into effect, really be sure you can change things on the fly depending on how things are going.
And really have those open, detailed conversations before the baby's born.
Exactly.
And then how do you manage that work-life balance, understanding what your parental leave benefits are?
Yeah, that's really important to know before the baby comes, what your parental leave benefits are, what that will pay out, how long you may be out for, depending on how you deliver, or God forbid, if your child has to go to the intensive care unit, which does happen sometimes. So those things can kind of change how long you're out of work for. I know a lot of dads will look into their position and sometimes split their leave at the beginning and at the end, the time off they take. So kind of knowing what you're able to do. One of the biggest pieces of advice I usually give all my new parents is to take as much time off of work as humanly possible, because this is a time for you to really settle down with your family and enjoy being a parent.
And then what about attending childbirth classes so that you are prepared?
Yeah, those are very, very important, especially if you're a first-time parent. The parenting classes will go through kind of what we're talking about here, the basics, things you expect. Scripps does have what we call getting ready for baby class, which is a similar thing. And even experienced parents will take these to just kind of remind themselves of what to expect.
So what should the dad's role be during labor and delivery?
I usually get this question when I do some prenatal visits, and they'll ask that very specific question: how do I really integrate myself into the process? And I always, with a smile on my face, say, be present, not only physically, but emotionally as well. Imagine that you're taking care of someone who's running a marathon. Be physically attentive, be emotionally attentive, and again, really try to integrate yourself in the whole process. Be there, experience it with your partner, and that I truly feel gives both parents a good experience.
And what about taking care of yourself and the baby's mom? So you talk about preparing meals and getting exercise and dealing with the big issue, which is sleep deprivation.
Yes. And one of the advantages you have if this is your first child is that there's only one child. So you do get the opportunity to kind of go back and forth if you need to in order to kind of take care of yourself. There is sleep deprivation that comes with it, and a lot of anxiety when you're not sure what's normal and what's not normal, and really lean on your pediatrician for that, because they can tell you what is normal. They can give you a sense of affirmation that everything's going fine. And if it's not, they'll tell you what to do about it. And when you are able to take all that into consideration, you're able to take care of yourself and your baby much better.
And then once the baby arrives, what should dads be focusing on to help bond with the baby?
Yeah, just time together, time with your partner, time with the baby, and really just being present. And that's why I really tell people to take as much time off of work as possible, because that's the best way to really integrate yourself into the whole experience.
And they talk about bonding, that touch is key, right? So maybe you want to make silly faces with the baby, or have a staring contest, or singing or dancing, just spending that quality alone time with the baby.
Absolutely. As much physical interaction as you can. Babies are doing very limited types of things when they're first born. They're sleeping a lot and they're feeding a lot, but they are awake at times as well. And whether they're sleeping or not, like you said, physical contact, very important. Talking to the baby, parents read to babies, so you can do all of that kind of stuff to really increase that bond.
And so what's the most important thing during those first few months after the baby's born?
I think just reiterating the fact that you should do the very best you can to really hone in on that family time. I think the biggest distraction sometimes people will get is they'll get a lot of outside information from people who are trying to help, and sometimes that's really good. But leaning on your pediatrician, leaning on your family members, and being able to really spend that time at home and not worry about work, not worry about the other things in life that try to work in there. I mean, you don't have a baby that often. You have your first baby just once in your life, and really trying to focus in on just being a little family selfish is what I call it, in order to really increase your experience in being a parent.
And being really present in the moment.
Absolutely.
Any final thoughts, doctor?
My only final thought is just try to come in as prepared as possible, but again, be flexible. Try to figure out who you want your pediatrician to be before your baby's born. So it's always good to kind of look into those things online. And you can even meet your pediatrician beforehand, like I said, in a prenatal visit, which is a very beneficial thing as well. So, but again, trying to be flexible with the plans and just moving along with things as they come along, because not only is that going to help you in the newborn period, that's going to help you as the child gets older from there.
Doctor, thanks so much for being with us. We appreciate you taking the time.
My pleasure.
So dads, if you'd like more information on how to prepare for the arrival of your baby, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.